law designed to help Oklahoma's childcare industry is now raising some questions from providers who say it may not help the families who need it the most.
If we're a family first state, then this is a big part of it.
House Bill 4298 gives child care centers more flexibility with staff to child ratio. It also allows facilities in state subsidy programs to charge families an additional differential fee, capped at 10% of household income. State leaders say the bill is meant to help centers keep their doors open amid staff shortages and rising costs, while still maintaining safe quality care. Bill also directs the Oklahoma Department of Human Services to create new master teacher ratios for higher star quality facilities and allow DHS to send licensing rule changes electronically. But for some providers in North Tulsa, the concern isn't the policy, it's whether families can afford it.
That's the main thing. And, I say it half-heartedly, but I do mean it when I say that, you may not spend that money in child care, but you will spend it in child welfare because there are going to be other situations that are going to arise when children who are not mature enough to be home are home by themselves.
And for owners at Jules Childcare, they say most of their families rely on subsidies or live on fixed incomes, making any extra fees unrealistic. They say the bill could help private pay centers or facilities in higher income areas, but may not provide real relief for providers serving low income communities.
Now that is where it becomes debilitating in order to be able to serve these communities. Every day we're getting these calls, we're fielding these calls about, I don't know how I'm going to make it, I don't know how I'm going to take care of payroll, I'm not worried about myself, I'm worried about my children, I'm worried about my employees.
Now, some providers are questioning whether DHS and state leaders fully understand the financial pressures many childcare centers and families are already facing. When we reached out to DHS about the new law, the concerns surrounding the law, and what this means moving forward, they sent a statement saying, in part, quote, because portions of the bill require policy updates and federal approval, OKDHS is currently reviewing implementation requirements and working with federal partners before changes can be fully operationalized. This legislation may help relieve some operational pressures providers are experiencing. We recognize there is no one-size-fits-all solution. An ongoing evaluation will be important in understanding how the legislation functions in practice across Oklahoma's diverse childcare landscape. In Tulsa, Jaya Brown, Tulsa's News Post.